Psoriasis. Psoriasis is a pathology in which the human immune system mistakenly attacks healthy skin cells. As a result, flaky plaques appear on its surface, which can itch a lot and even hurt. Sometimes the disease is also accompanied by inflammation of the joints and eyes. What is psoriasis? Psoriasis is a chronic autoimmune disease in which red flaky spots appear on the surface of the skin. They are often called plaques. Psoriasis cannot be contracted. It is an autoimmune, not an infectious disease. Psoriasis manifests itself as inflammation of the skin, as well as abnormally rapid growth and exfoliation of cells, keratinocytes, which make up the stratum corneum, the epidermis. Normally, it is completely renewed in a month, and in people with psoriasis this process is accelerated many times over and takes an average of 3 to 4 days. In addition to skin lesions, the disease causes joint inflammation, in about 30% of cases. A little less often, in 10% of cases, psoriasis leads to inflammation of the vascular membrane of the eye, uveitis. Prevalence of psoriasis. People aged 15 to 35 most often suffer from psoriasis, but in general the disease can manifest itself at any age. The first peak of the onset of the pathology occurs at 15 to 20 years, the second, at 55 to 60. On average, psoriasis affects about 1 to 2% of people worldwide. Psoriasis has 3 stages: progressive, stationary, and regression, remission. In the progressive stage, red spots appear on the skin. Merging, they form large flaky plaques with a pronounced red outline along the edges. It is called an erythematous crown, or growth crown. New plaques itch a lot and can hurt. Injured areas of the skin are especially susceptible to the appearance of new spots. A psoriatic plaque can quickly develop at the site of friction, for example, against clothing, as well as in the area of a scratch or comb. Doctors call this phenomenon the Koebner phenomenon. This phenomenon, also known as the isomorphic reaction, was discovered by the German dermatologist Heinrich Koebner in 1872. The doctor noticed that in some patients with psoriasis, new plaques appeared on the skin at the sites of injury, for example after scratches, injections or bruises. Stationary stage, stabilization phase. Plaques stop growing, but continue to bother and peel. New rashes and spots, as a rule, do not appear. The regression stage occurs when the manifestations of psoriasis begin to disappear. Peeling passes, plaques become lighter and flatten. Symptoms in this phase decrease. By severity. To assess the severity of psoriasis, doctors use the PASI, Psoriasis Area and Severity Index, system, an index for assessing the severity and prevalence of psoriasis. It requires professional analysis of such parameters as the severity of erythema, infiltration, scaling, and calculation of the area of skin affected by rashes. Depending on the results of the examination, doctors distinguish mild, moderate, and severe degrees of the disease. By form. According to the clinical picture of manifestations, several main forms of psoriasis are distinguished: vulgar, inverse, seborrheic, exudative, guttate, pustular, psoriasis of the palms and soles, and psoriatic erythroderma. Vulgar, common, psoriasis is one of the most common forms, accounting for about 90% of all cases of the disease. At first, red spots appear on the skin, which in a few days transform into convex flaky plaques. As the plaques develop, they merge into large itchy and flaky lesions. Then the condition goes into a stage of stabilization and regression. The manifestations of the disease temporarily recede and the person's health improves. The most common places where vulgar psoriasis appears are the extensor, outer, part of the skin of the elbows and knees. Lesions also appear on the trunk and scalp. Inverse, reverse, psoriasis proceeds in the same way as ordinary psoriasis. The only difference is in the location of the lesions. They appear not on the extensor, outer, part of the knees and elbows, but on the flexor, inner, part, that is, under the knee, under the armpits and in the elbow bend area, as well as in the neck, eyelids, navel, and groin folds. The skin in these areas is more tender, moist and often rubs against clothing. Because of this, it can itch more than with the usual form of the disease, but the peeling in these areas is less pronounced. Seborrheic psoriasis proceeds in the same way as the usual one, but its lesions are located in places with a large number of glands that secrete sebum. This is the hairy part of the scalp, the folds behind the ears, the cheeks and nasolabial area of the face, the forehead, chest and back, mainly the upper part. Exudative psoriasis is a type of disease in which, in addition to peeling, exudate also appears in the affected area. This is a liquid containing protein, some blood cells and other substances. Exudate can be released from the capillaries during inflammation. The crust on the surface of the plaques in the exudative form of the disease is usually dense, grayish-yellow, sometimes slightly moist. This type of psoriasis most often appears in people with endocrine disorders, thyroid pathologies, type 2 diabetes or obesity. Guttate psoriasis does not manifest itself in plaques on the skin, but in numerous papules, swollen points of bright red color with peeling in the center. The size of the papules can vary from about 1 to 10 millimeters. They mainly cover the trunk, arms and legs. Guttate psoriasis usually occurs in children after streptococcal infections, for example, tonsillitis. It is treated somewhat better than other types of psoriasis, but in some cases it can develop into a common, vulgar, form. Pustular psoriasis is characterized by the appearance of multiple pustules on a red erythematous background. Pustules are formations that are very similar in appearance to pimples. Such psoriasis can be a consequence of infectious diseases, stress, hormonal imbalance, improper medication intake or inadequate use of ointments. At first, numerous pustules appear on red spots. Then they merge into one large purulent spot, or purulent lake. The generalized form of pustular psoriasis is difficult to tolerate, with episodes of fever, weakness, as well as severe pain and burning of the skin. In parallel, changes in nails and pain in the joints can be observed. Psoriasis of the palms and soles. Typical psoriatic rashes appear on the palms and soles, less often in the form of localized pustular psoriasis. It can also affect and deform the nails. They thicken, become cloudy and uneven. Psoriasis on the palm. Erythrodermic psoriasis is quite rare and is considered an extremely severe form of the disease. Redness is observed on about 90% of the body, severe itching and pain appear, the skin swells and peels. The temperature often rises and the lymph nodes become inflamed. Usually, this type of psoriasis is the result of an exacerbation of another form of the disease due to improper treatment or unfavorable environmental factors, for example, sunburn in vulgar psoriasis in the progressive stage, inadequate use of irritating external agents or intravenous administration of glucocorticosteroids. Symptoms of psoriasis. The manifestations of psoriasis vary depending on the type of disease and its severity. Common symptoms and signs of psoriasis. Red, raised, flaky patches on the skin. Itching in the area of inflammation and flaking. Nail changes, pinpoint depressions, thickening and crumbling of the plate, its separation. Joint pain, sometimes. For an accurate diagnosis, you need to contact a specialist, a dermatologist. Causes of psoriasis. The exact reasons for the development of psoriasis have not yet been fully studied. However, many studies agree that the development of psoriasis is associated with genetics, as well as with lifestyle, concomitant diseases, and unfavorable environmental factors.